Anyway.
So you're going to be with Dana tomorrow. You're going to be with my Dana tomorrow.
Right.
Dana Namor.
Yeah. She decided she'd take Friday off or something.
Yeah.
Ship you out here.
Good evening, everybody. Welcome to the beautiful Glendale Civic Center. Tonight we have an evening for you which will include an opportunity to learn from experts. We'll hear from a real, live, in-person member of Congress. I know. It's very unusual. We would ask that the behavior of those in attendance this evening should reflect our organization's peaceful ideals. Hey everybody, I'm Wendy Garcia, and I represent here tonight the unified effort of indivisible groups all over Phoenix. For those of you who do not know, Indivisible is a grassroots organization. We came into being as a result of the 2016 election. Our mission, our goal, to encourage civic engagement and communication with members of Congress. If you would like to learn more about Indivisible groups, please make sure you've signed up on our roster or the sign-in sheet as you enter the door, and somebody will contact you, of course. You can also go to indivisibleguide.com. So we the people are here tonight. What's that? Oh, well, I know. It's not my normal thing. So we the people are here tonight with thanks to the Arizona Democratic Party. Yes, ADP was very kind and helpful to facilitate not only this wonderful panel that we have to address you tonight, this wonderful room tonight, and the presence of Congressman Ruben Gallego is here. So many of you know that last week a small group of moms and dads and grandmas and grandpas went into Senator Jeff Flake's office. We went in to ask for a constituents roundtable. We just want to have a conversation, just with a small group. Nothing like Mesa. So, you know, we want to talk about health care. The conversation needs to happen. It needs to happen every day. And it certainly needs to happen with our members of Congress. And it definitely needs to happen with Senator Jeff Flake. Where is he? We asked to have the opportunity to speak with his scheduler. We were told that the scheduler was simply out to lunch and would be back shortly. We were encouraged to wait for the scheduler to return from lunch, so we did. We waited and waited and waited and waited some more. We waited until the end of the business day,
It was a
as a
long
matter
lunch.
of fact. It was a very long lunch, and we're not even sure she exists. And in the days following, despite the fact that we did, submit a written request at that time for a roundtable, we've heard nothing in return. So as a result, we just took a little trip down there on Monday, closed, and we taped a request to attend this town hall to the front door. And we haven't heard much of anything from him, other than it is my understanding he's fled the state. Actually, in attendance tonight is Arizona's representative from the 7th District. We are very pleased at this time to introduce the Honorable Congressman Ruben Gallego. Let's hear it.
Well, thank you. Thank you, everyone, for being here. Now, it is customary as a former Marine, as a current Marine, that if there is an American flag, we should stand and do the Pledge of Allegiance before we get going. So please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice Thank you. I think it's a good reminder of ourselves, Democrat, Republican, Independent, Socialist, Conservative, whatever your title is, we are still Americans, and we want the best for our country and our people. I am not Randy Freese. I don't know why this is up here. I think he's taller than me. So, well, let's begin with a couple things. You know, I'm here to talk about what we are seeing in the Senate bill. The Senate bill that's supposed to be a replacement of the Affordable Health Care Act. By any measure and standard, this is not a replacement. If you want to take the words of President Trump and what he said during the campaign, he said very clearly that whatever replaces, in his words, Obamacare, it's going to be cheaper, it's going to cover more people, and better. If you take him at those words, what came out of the House and what is coming out of the Senate, that does not even hit Donald Trump's standards. If you take him at his other words said that he would never, ever, ever cut Medicaid. This would be one of the deepest cuts to Medicaid, to the point it would potentially put it on a lifeline for many states, and would, especially here in Arizona, would kick people off Medicaid and have dramatic effects. And we know they have dramatic effects because this happened already in Arizona. I was lucky enough to serve in the state legislature from 2011 till 2014. Within that time period, I saw two things happen. When we started capping Medicaid enrollment, which is what's going to happen with if you pass the Senate version, people started getting kicked off Medicaid. If you made $1 more than you were supposed to one year, you were kicked off Medicaid and you weren't allowed to re-enroll back. For some reason, you missed any type of, or violated any type of rule that somehow got you kicked off Medicaid, you weren't allowed back. Thousands of people were basically essentially being weeded off Medicaid, including children. Where did those people go? Do you think they just started going and paying for their own private health insurance? No, absolutely not. So they started going to our emergency rooms. And our emergency rooms, of course, starts taking them because they have to, because of EMTALA law, and also just because they're good human beings. And so while I'm in the legislature, we start seeing these conversations with rural hospitals where they start telling us, like, we're about to shut down. And why are they about to shut down? It's because they have to start taking care of these human beings, and they're taking care of them at the most expensive time of their type of treatment, and essentially at the last basic second, because they're using that emergency room as their primary care physician. And what happens is these emergency rooms start basically taking on all these additional costs that they can't recover. So first they try to recover it through the people that are insured, so premiums start going up. But at some point, insurance companies just say, no, we're not going to pay you. Like, figure it out. Is that the Russians? Wouldn't surprise me. So these hospitals basically start eating these costs, and they continue eating these costs. And the rural hospitals, because they are basically the only centers for medicine in those areas, have no choice. They can't even get scale because they can't work with other entities. They can't ship people off to an urgent care. They can't work with other hospitals. They don't have MIHS like we have. So what we started hearing at these rural hospitals, they're going to shut down, and we're going to have to basically helicopter people over to Phoenix or to Tucson if it's a real emergency. So that's when we start seeing this push to expand Medicaid. And you start seeing it eventually moving into our even urban centers, who are starting to also see the same problem. So we, and I say we, a bipartisan group of Democrats and Republicans with Governor Brewer. I actually hugged Governor Brewer, mind you, after we signed this deal. Hey, it got 200,000 people health insurance, I'll hug anybody. I'm not afraid of a good deal. Democrats, Republicans, Governor Brewer, we all got together, the business community, and decided the best way what we can best do, both for the economy, as well as this vast population of people that are on Medicaid, and including the people that aren't on Medicaid but get ancillary benefits by more people being covered, that we should tax ourselves to pull down the Medicaid expansion money that was being offered through the Affordable Health Care Act. And what have we seen? The largest job sector growth in this state for the last 2 years has been in healthcare. We have seen largest amounts of people being insured that had never been insured before. We're seeing better healthcare outcomes. We're seeing all these good benefits. Now, that's just on the Medicaid side. So what do we know that the Senate bill does? The Senate bill essentially says, and you're going to hear this, like, well, there is more money going to Medicaid. Okay, on the face of it, yes, there will be more money going into Medicaid, but it is going to be so small, it's not going to be able to keep up with the rate and cost of medical costs that occurred in our community, in our medical communities, right, or in general costs, in addition to population growth. So I'd like to give an example to Donald Trump, because sometimes I think you have to break this down into Donald Trump world. It would be as if you had 100 apartments 1 year, and then you had 120 people that needed them the next year, but you only offered 110 apartments that year. That means you don't have enough apartments to go around. So that's essentially the shortage and rationing that's going to have to take place. And that's exactly what we would end up ourselves in Arizona. What you would end up seeing is our state reps, and not the good ones that we work with, would start rationing Medicaid to figure out who can they at least still give health care to and who they may not need to, or they could go without. And that is not a good situation when you're doing that. I saw that, and it was not pretty hearing about the amount of people that went without care, and we certainly lost people. People died waiting to get back onto the Medicaid rolls. Now, this would be something that we can all, maybe swallow if we were at a financial situation where we had to make some hard choices. This isn't a hard choice. They are taking $700 billion out of the system that essentially pays for the poorest of Americans to have insurance coverage, to give it essentially to the top 1% of this country. The middle class will hardly see anything from this. Even us little rich members of Congress will barely see something. It is the top 1% that will get some of the highest returns on this. 1% that does not need it, the 1% that mostly aren't even asking for it. But what we're going to do is essentially kick off millions of people across this country off health insurance by choice, because we're making an economic value choice that we'd rather give a tax cut to the rich than to take care of our working poor and our children that are on Medicaid and our elderly. And I know if there is an expert here that could correct me on this, I believe that 30% of our senior care centers, 30% of senior care centers are funded through Medicaid. So it's not just the people that are barely working or don't want to work or can't work. It is also the people that have worked their whole lives and are trying to finish out their golden years in comfort. And that has dire effects. So now let's move on to the second portion of this, the actual subsidies that you get through the Affordable Health Care Act. I agree with a lot of people, and I agree with my Republican friends. The Affordable Health Care Act is not the best insurance program that we could have created, the national insurance program we could have created. You would have asked me, I would have had Medicare for all to begin with. Okay. If I can't get Medicare for all, give me the public option. If I can't do that, at least let's drop Medicare to the age of 55. There's so many ways we can do this. So many ways we can do this to make sure that we cover more people and bring down premiums and save our overall healthcare network. But politics is what it was. We got what we have right now. It's not the best program, but we know what the outcomes are. We know for a fact that it's already saved money into Medicare because people are healthier as they age into Medicare. We know that more people have coverage ever in the history of the United States. We know that there are no pre-existing conditions. We know there are no lifetime bans, lifetime caps. These are the things we know. So let's look at the Senate bill that potentially Senator Flake is going to be voting for. What do we know occurs there? One, there's no guarantee that there's going to be pre-existing condition protections. The horrible stories you've heard from your friends, from your family members, or that you actually experience where you will be denied coverage because of pre-existing condition, or you will have to pay insurmountable amount for coverage, will be back. There is no guarantees of any of that in the Senate bill. Number two, lifetime caps. There is no guarantees at all, not in this bill or any version, that there will not be lifetime caps put on individual insurance holders. That is just the one problem. Two, even the subsidies they do keep are designed essentially to help those that already are very healthy and already would have very low premiums. Under this Senate bill, the people that make out the best are young men in the mid-20s that are making more than $74,000 a year. They have the lowest premiums. The people that make out the worst are men and women above the age of 60, but above the age of 60, before being Medicare eligible, making roughly around $30,000 to $38,000. Their premiums would potentially go up to $14,000 per year. And that's from the CBO score. And which is why, if you may have heard that I was very anxious to make sure that Speaker Ryan understood that we needed to hear the CBO score, well, because that is what tells us the future is going to look like. The Senate knows what they voted for. The House knows what was voted for. The House version had 24 million people getting kicked off within 10 years. The Senate version has 23 million people getting kicked off in 10 years. And they call that an improvement. I really wish they were my mom, because she would have seen my C to C plus grade improvement, and I could have called that a victory. But when you go from 24 to 23 million people, that is not a victory. You're still kicking off too many people off this. And for what? What we know for a fact is this is not an insurance program. This was first designed as a tax cut, and then they try to wrap around an insurance program on it so they could essentially get the tax cut, even though we're going to end up having a very bad national insurance program. That's essentially what this is. Because if they were serious about actually creating something and improving the Affordable Health Care Act, there's tons of ways you can do this. Heck, if you wanted to do it even in a more conservative manner, there's a tons of ways you could do it in a conservative manner. But you actually have to spend money and do it and not take $700 billion out of the system. And lastly, just to remind one more thing. Do y'all remember around when the ACA was going around, when they were yelling about the individual mandate? How dare government make you buy something? How dare government make you buy something? You know what? Ideologically speaking, I think you could say one thing or another. Russians again? Okay. Ideologically, you could say one thing or another where that government should be able to do that. Taking economics class, my econ professor, who worked under George Bush Sr., who was a professor was a visiting fellow at the Cato Institute, a libertarian think tank, came up with the individual mandate. The individual mandate was originally a conservative thought about how to spread the cost of health care over, get a good mix of healthy to not healthy people to bring down the overall cost. So, fine. For some reason, when the Democratic president is for it, all of a sudden they're against it. Okay. We could all take our reasons why that may be or may not be, but that's what happened. But let's look what they're doing in this bill. Okay, the individual mandate is gone. If you don't buy health insurance, you don't have to pay a tax to the government or a fee to the government. But do you know who you have to pay? The insurance companies. If at any point you drop your health insurance, you miss a payment, for some reason you just forgot to re-sign during the enrollment period, you first have to wait 6 months to re-enroll, and then there's a 30% premium fee increase on that. So who gets that? The insurance executives are going to get that. The insurance companies are going to get that. So all in all, there is nothing in this bill that is telling us that there is going to be a better outcome. You tell me that we can work together and get a better health care outcome. I don't care what party you're with. I'll join you. But if you're going to tell me that by doing this, 24 million of our poorest people are going to be kicked off, and premiums are going to go so high that those that do want to buy it will not be able to buy it, or if you're going to buy it, you're going to have to make the choice between insurance and rent, or insurance and mortgage, or heck, insurance and a vacation, that's not what we should be doing. And we should certainly not be doing it because we need to give the top 1% a tax cut that they don't need. So I really encourage you to continue this. This matters. Now, I know people are like, well, it's all the same people that keep going to these events. You need to keep going to these events. You need to keep calling your senators. You need to keep talking to your neighbors. You need to continue pushing on the media so they understand that this is not a gimmick. This is life and death situations that we have to figure out. And if we support the Senate bill, if the Senate bill passes as it is, I am not exaggerating, there will be unfortunately people that will die because of maltreated diseases or non-treated diseases. That's just a fact. It doesn't mean that the Senate Republicans are evil. It doesn't mean that individual Republicans are evil. It just means that when you start making stark choices like this, there's bad outcomes that happen, and that's one of them. So continue with your energy, continue pushing forward, continue calling, emailing. If it makes you feel better whenever you get rejected by everybody, you could throw in a call to my office. We'll pep you up, and then you could call back again. But we are here. But we are here to as an office, not as an office, as a political event. I am here as an elected member of Congress, a Democrat, that will continue pushing for us to have better health insurance, and not certainly what they're trying to pass right now. So with that, I think, am I turning it over? I could probably take one or two questions, and then I have to head out. Is that right? Correct? Okay. Are you loud enough? Do you need to go to Mike?
Governor Ducey's 5-letter, 5-point commitment, can you explain what's going on?
No, I can't because I didn't read it.
Okay.
But if someone has it, good. Anybody?
I was just going to say that he asked for 5 specific things to be, augmented to the bill, and I understand that McCain is working on amendments in regards to them, and it's like a slower off-ramp for the end of the Medicaid expansion. A reduction of the penalty for early. Oh, here we go. Yeah.
Yeah, it's the letter to John McCain and Jeff Flake dated June 21st. Dear Senator McCain, starts off by saying, as you know, I have said for years that Obamacare is a policy disaster that must be repealed. Then, slowly down there, he says, but please, don't take my money.
Right.
Oh, yeah. And so he has 5 different points here to say, we need a phase-in for the proposed formula changes on Medicaid. In other words, it would be phased in so they wouldn't hit until I finish my second term in office.
And I'll tell you why that is. Give me a second. Go ahead.
Elimination of the early expander penalty, which is actually Arizona expanded in the year 2000. Reasonable inflation adjustments, which is really what you've been talking about also. Explicit flexibility, not promised in going down the road. In other words, give me the money and let me decide how to spend it.
Which is a horrible idea.
Well,
So,
I was the Access Director for 7 years, so I've been through this drill a few times. We can talk about that. And then Tom Betlock, who's the current Access Director, had a document that is attached to that and basically said, if you go down the road that we're going down right now, Arizona's Medicaid program is going to lose $7.1 billion. Now, understand, that's over a period of a number of years, but understand the State General Fund this year is $9.7 billion. So you take $7.1 billion, not million, we said not million, billion out, and the budget itself is just slightly larger than that.
essentially the reason that Governor Ducey is actually worried about Medicaid expansion being phased out too quickly is because he loses the federal drawdown that goes into the state coffers.
Right.
And then he can't continue to give all these tax cuts to the corporations that he's been given to for the last couple of years. So if all of a sudden this money, there's a hole in the budget, which I think Representative Ray Martinez, it's about, what, $280 million if it goes? We'd have to find how to get $280 million. There's not much room in this budget to actually find $280 million. So the only way you actually do it is you have to go further cuts. Well, the only place you still have to cut is education, because he certainly is not going to raise taxes on his corporate buddies. That's what he's worried about. That's the biggest gist of this. It's like, please just give me enough time so I don't have to raise taxes until I'm out of office and I can hand this off to the next Democrat. But of course, we'll defeat him before that, too. Yes. Yes, sir.
How does one respond to the argument that the problem with the Medicaid costs aren't this bill, but the cost of healthcare? We need to bring cost of doing healthcare down.
Well, okay, so, I mean, and we're going to have some extras, but here's my personal opinion. First of all, if you actually look at the Arizona system, Medicaid's actually our access system is one of the best run in the country. And it's actually something that I have always advocated other states should follow in terms of containing costs. As a matter of fact, isn't that part of the acronym? Arizona Healthcare Containment Cost System. And so it's actually one of the best ones. Now, in terms of the overall bringing down the cost of healthcare, one of the things, and the people that have MDs or PhDs in front or behind their names will be able to explain this better than I will, but one of those things that was really important about the Affordable Health Care Act is that it started switching to a program where we started paying for wellness instead of fee for service. And what that means is that the incentives for a doctor and a patient are not going to be the same. Instead of a doctor saying, oh, you're hurt, here, do this, do this, do this, and then we as both the government as the insurers would just pay per fee, we were moving to a system where we're going to pay for the overall wellness of a body. So that way you actually end up kind of bending the long-term care costs when it comes to health care. Part of the problem with this bill, the one that's in the House, is they take away that. They take both away those incentives, and we go back to that fee-for-service program, which will eventually put us into a situation where we're going to keep on increasing the cost of health care. By the way, do you know one of the most odious things about this, and this is actually in the healthcare, the Affordable Health Care Act, or if you want to call it Obamacare, they cap the amount of compensation healthcare executives can get. Hey, guess what's not in the Republican version of this? Shocker, right? All right, we're going to take one more. Yes, ma'am.
There was a newspaper article on the 4th of April saying the 5 things that are wrong with the Affordable Care Act. I happened to use that, and can you tell me if it seems to be working pretty good? The only thing that I think of that isn't really good is that you can't compensate crime.
Okay, so there's a couple, in terms of the state line question, right? So you're going to hear this as kind of like conservative dogma, like, well, you should be able to buy health insurance across state lines. So you should, if there's an insurance program in, I'm not going to pick a state because whenever I pick a state, I piss off that state. Let's just say a state that everyone likes, Washington, right?
No, pick Mississippi.
No, I can't. Last time I did that, I got so many like.
Doctors in Biloxi. Go there. You know?
I got a lot of hate mail from Mississippi when I picked on them last time. So we're not doing that. But let's say Washington State. Let's say Washington State has the most stripped down health insurance possible, right? Where it's basically going to just cover emergency care and maybe primary care, but won't cover anything else. That's true. You could go buy that. It'll be really cheap. But essentially you're going to start a spiraling effect where people are all just going to keep looking for the cheapest health insurance. And you end up going back into this bad incentives where you're still going to end up having uncompensated costs. Because let's say you have a bad plan and you still can't afford what ends up being your co-pays. So what ends up with that money? Well, again, you go back to the uncompensated care situation, right? Which is why the Affordable Health Care Act set standards, national standards, that everyone had to meet in every state if you're going to be part of the insurance market. Now that gets taken away. And the reason it gets taken away because the only way that you could technically bring down premiums is by really offering bad plans that don't do anything. It's like the Trump universities of college. Honestly, I could give you $5,000 and you could get a degree from Trump University, or give you $5,000 and you get a degree from ASU. Which one's a better use of your money? Right? Which one are you actually educating yourself in? No offense to the U of A people. Great school, and NAU, and Glendale Community College. Did I cover anyone? Grand Canyon, right? We're in Glendale. All right, Grand Canyon. So that's one. Two, the reason premiums were higher. This is one of the things that I dislike about the Affordable Health Care Act. It's like premiums did rise. You had better plans. More people needed to get covered. More people bought in. But because more people were in, there needed to be a good mix between the people that are healthy, the people that are medium healthy, and the people that are unhealthy. And we needed to make sure that the way we brought down costs is that we were going to give some breathing room to the insurance company through what's called the risk corridor. And what ended up happening is when the Republicans shut down government, part of the deal was that they, to reopen government, and we should not have done this, and this is the fault actually of President Obama and the Democrats, not just the Republicans, we said, fine, give us the vote to reopen government and we'll take away risk corridors. And what ended up happening is a lot of the insurance companies that were losing money because they were insuring people that are high-risk insurers started losing money, so they started passing off the premiums to more and more people. And that was, if you watched the presidential race last year, I'm sure we all did in this room, Marco Rubio kept bragging about how he was able to kill, health insurance, or the Affordable Health Care Act. That ended up being costing. The other thing is we had a system where we were essentially going to fund across the country nonprofit health clinics. And that would also have been extremely important to really take care of a lot of our population that require a lot more attention when it comes to insurance. And we basically took that out and gutted that. And there are no more clinics of that system around. And those two things, I think, were both, when designed, were really well. But the fact we didn't implement them is what had really drove up the costs when it comes to health care. And lastly, when the Affordable Health Care Act came through, it was mandated that every state expand. And had that happened, that actually would have also brought down overall premiums. But because it went to the Supreme Court said, no, every state has a right to decide how to do it, when to do it, and that is where we ended up having this mismatch or hodgepodge of states that had it and don't have it. So those are the areas that can improve. There's a lot of other improvements that we can do. I think, either expanding Medicaid in terms of income level eligibility or bringing down Medicare is one step in between that could also help overall and keeping the current system. So we're going to have some experts here. I'm sorry, I actually have to go back to downtown to give a speech, but we're going to have Wendy take back over. Yes. Is that right? Yes.
Can I ask you a quick question?
Okay, fine. Since you're the organizer, I guess I kind of have to.
Should my congressman be able to tell me how many kids will lose health coverage should the Medicaid expansion repeal with ACA?
Per congressional district or the state?
Congressional district.
They should. I mean, that information is generally extremely easily and accessible. I mean, in my district, it's 55,000.
I told him he should Google it.
That's all right. I mean, you could contact access. Before I go, it's also very, very rude for me not to recognize the elected officials in the room. We have State Representative Ray Martinez. Represents this area. And we have State Senator Martin Quesada in the back. State Representative Randy Freeze is back there. I'm getting around. State Representative Randy Freeze from Tucson. We have State Senator Steve Farley. Did I miss any other elected officials? Thank you guys for continuing the fight at the State House and the State Senate. Please, it matters, especially when it comes to Medicaid expansion. Many of you have worked with me on that for many years, and we got to continue keeping that, and you guys are part of the front line. So thank you again. Please keep up the good work, and thank you to everybody that organized this and our people that are going to stick here and have questions. Thank you.
Ladies and gentlemen, Congressman Ruben Gallego. Let's hear it for him. Pretty brave to be out here today. I'd remark that he's probably the hardest working congressman in Arizona. Sure is out to talk to people.
Great job.
There we go.
Great job.
So I want to give you this.
Oh, okay.
It's an Invisible surprise t-shirt.
I lost a lot of weight. I'm not an extra large.
Okay, there's another size.
Dim shirt.
There's another size out.
Thank you guys.
Congressman Ruben Gallego, everybody. And now I would like to invite and welcome you to ask any question that you have burning on your mind about the future of your health care, the current status of your health care. We have some of the best health care experts, the top experts in the state are here tonight, and Legislative District 9's Assistant Democratic Leader in the House, we've got Dr. Randy Freeze.
Thank you, Wendy. Thank you very much. It's my pleasure to join you here tonight. Thank you all for coming out on this very, is this Ruben's watch? Nope. Okay. It's a fancy watch. I thought it was a congressman's watch. I'll leave it here so I can keep them. So again, thank you all for coming on this warm Friday evening. And information is powerful. Thank you for coming to get informed and help us be informed on your concerns. So again, I'm Dr. Randy Freeze. I am a state legislator, also a practicing surgeon in Tucson. I'm trauma critical care provider, so I still take care of patients in the hospital. I am on the front lines of health care, and I recognize some of the problems, and I have some ideas for some solutions that I'd like to share through my job as a policymaker and also through my job as just helping inform the public. Real quick, before we move on to introducing the panel, I just want to recognize Raquel Terran, also from Planned Parenthood, here this evening. Thank you, Raquel. And getting to our panel, first we have Dr. Leonard Kirchner. As you heard, he was a prior Access Director. Dr. Kirchner?
I'm a physician. I was in a orthopedic residency in San Francisco, and Uncle Sam sent me a letter. And the next thing I knew, I was in Da Nang. You know that. I saw the Vietnam hat. I spent 22 years in active duty. My last assignment was hospital commander at Luke Air Force Base. And they decided I needed a staff job in D.C., and that's when I retired. And we started Mercy Care Plan with the 4 Catholic hospitals in the state. And we had a new governor, and I got appointed as the Access Director. I worked for 3 governors. Only 2 of them were criminally indicted. And so you'll have to figure out who they were. And then I've been on the board at Sun Health before we sold it to Banner Health. I was the vice chair of Del Webb Hospital. How many of you are from the Sun Cities? Yeah, out there. Some of you have been to... Yeah, well, that's good. And whatever. And I've been involved in a lot of the healthcare industry for a long time. I'm on the State Medicaid Advisory Committee, and I was on the Arizona State Trauma Advisory Board. Their nicknames are Smack and Stab. So, I was smacked and stabbed by the state for providing services in those 2. We're going to talk about a lot of the things that I know that you want to talk about going forward. Repeal and replace. What a great line. And it really worked good when they weren't in power because they could repeal and repeal and repeal, and they had no plan. Repeal is easy. The House voted 60 times. Replace is damn hard, mainly because we can talk about all the things that people like about the Affordable Care Act, and it's almost universal. That includes Republicans. They like what's in the plan. They hate Obamacare. They like the Affordable Care Act, mainly because they don't know it's the same goddamn thing, what are you going to do? Anyway, we're going to talk about that.
Thank you, Dr. Kirchner.
Hey, a Vietnam guy over here, we can talk that way, right? Right.
Thank you. We'll get to your questions in a minute. Let's just finishing introducing the panel. Next, we have Siman Kasum from Children's Action Alliance. Come on.
So I'm Len's #1 fan. I love being on panels with him. I worked abroad and here and in public health, and now I advocate for children in the area of health policy, and I'm very happy to nerd out to the max on this bill with anyone.
Yeah, we like the wonky stuff. Next, we have Michael Boylan of Crisis Prevention and Recovery in Phoenix. Mike.
Thank you. Well, it's great to be here. I see so many familiar faces of folks that have been proud to stand on the picket lines outside of Senator Flake and Senator McCain's office. So it's great to see so many wonderful folks. I'm a proud social worker. I've been working in healthcare in the mental health field for 25 years. I'm originally from New York. And I've been working for a group called Crisis Preparation and Recovery for the last 17 years. I am new as far as the chief executive officer to that organization. And it's a wonderful group of psychiatrists, psych nurse practitioners, clinical social workers, and counselors. And we do a lot of work in the community, both in hospital settings, skilled nursing facilities, in our own office locations as well. And we have seen the benefits of the Medicaid system, the Medicaid expansion that has occurred since 2014. And we are really kind of do our role as in my position as not only the CEO but as a social worker, the importance of speaking up, helping vulnerable populations, and really caring for the citizens of our states like they're our families and our neighbors.
Thank you. And last on our panel, and of course not least, is Sam Richard from PAFCO, Protecting Arizona's Future. Sam and I work together a lot down in the legislature.
That's right. That's right. Thanks so much for having me. So when Wendy said we had just a minute or two to introduce us and what connects us here, so I was thinking a little bit about what I can do in just a minute, and what came to my mind was that Jay-Z just released a new album this week, and in it he has a line that says, "This was supposed to be a haiku, but my story's too wide for just a line or two." And I think that has a lot of connection to this healthcare talk, that we think that healthcare is easy, and we know that the president thought that, because who would have thought that healthcare was this hard? But I think that this is one of the things that's at the center of this conversation and this debate. The elder Cuomo, the current governor of New York, Andrew's father, used to say that we campaign in poetry and we govern in prose. Whether that was haiku or limerick or whatever, we have reversed that conversation a little bit, or at least attempted to make both of them poetry. And we cannot govern in poetry, and I think that's what we see right here, where the rhetoric is leading the conversation of healthcare. That's why you have 4 wonks on this policy, or on this table here, because we're going to get a little bit into the weeds, and I think that that's important for a big conversation here, like the Affordable Care Act.
Okay, thank you. Well, our goal here tonight is to help you understand what's going on, give you information. So if you have a question for the panel, please feel free to stand up in line at the mic. We'll go one by one. I would like to use the mic just in case someone's recording. We can certainly make sure we hear very well what the discussion is. I'll start off, because I'm the moderator. I get that prerogative. And please feel free to line up anytime. So let me ask, we briefly talked about it when Ruben was having a discussion. You pulled out the governor's letter. Let me ask you, Dr. Kirchner, you were the prior director of Access. Help me understand it. It seems to me that a single payer might actually be a good way to contain costs. Is that a good representation?
Well, certainly, almost every industrialized nation in the world does it that way. And so the question that had been raised, and I can go back to 1906, and Teddy Roosevelt proposed it. Franklin Roosevelt in 1944, in his second Bill of Rights, said health care is a right. So let me ask you a question. I'm going to take a vote. Should health care be a right to all Americans?
Should health care be a majority here, yes.
Should health care be a privilege to just those who can afford it? Okay, that's the debate that's going on now. Is it a right or a privilege? And I stand with those that say it's a right. We should have coverage. Now, the question is, how do we do it in this country? Because it's done. Our healthcare system is quite different than any others. Donald Trump was interesting. He had a meeting with the Australian Prime Minister and said to the Australian Prime Minister, I hear you have a really great healthcare system. He didn't understand. He has a single-payer Medicare for all system.
Can I say something on that?
Only in this country can say something like that.
I just want to mention something about that. So I think that a lot of people are talking about Medicare for all, and I think that that's a very good place to perhaps start that conversation. But I think that Simon and I think even Dr. K, I'm sure Mike agrees that we should also consider looking at Medicaid for all. We talked earlier about how efficient and how effective our access system is here. So I know that it's a more popular one-liner right now in the national zeitgeist to talk about Medicare for all, but Medicaid is a much better system. So Medicare for all. And there was a great bill in Nevada that the governor unfortunately vetoed there that would have opened up the Medicaid system for everyone to opt into. And I think that there might be some exciting things happening here over the course of the next few months on that, but I think that that's one way to go. So I just want to kind of implant that into your mind, that Medicaid
Sam,
for all is a good way to go.
Just so happens that here's the best newspaper in Arizona, the West Valley View. And they have a letter on the 5th of July, which is 2 days ago, from me. It says Medicaid for more. And I quoted what happened in Nevada, and I said, our system works. We should consider it. And really, we have added, between CHIP and Medicaid, we've really added to those coverage. So anybody would like to see my personal copy here of the West Valley View, which has a great letter from somebody with my name.
I'm sure it's available online as well.
Yeah.
Before we move on to your question, can I just extend this discussion for 1 second? Someone brought up the issue of quality, and I think that's something that we need to pay attention to is, can we still deliver the same quality when we're talking about a single provider? Anybody want to tackle that one?
Well, I mean, our current Medicaid system access is mostly a managed care system. And so that really gets at some of this quality and away from that fee-for-service that Representative Gallego was talking about. The people who are on Access or DDD or any of the programs that really are Medicaid in Arizona are able to access the same provider networks. And by the way, the insurance companies that, are providing this care are 30% of them are on value-based contracts. And that's exactly that kind of care that Representative Gallego was talking about, where it's not fee-for-service, how many MRIs can I give you for your broken ankle, but how can I get you healthy again? And there are all kinds of quality metrics and stuff like that, and they are incentivized for keeping an entire population healthier, which is about bending the cost curve and getting to where we want to be.
And if I may add, prescription drug rebates are bigger in the Medicaid program.
Huge. Mm-hmm.
That's another interesting difference.
I just want to add just one piece about the Affordable Care Act that has been so helpful that we've seen over the last several years is the access system has been really taking the lead on really making providers work together. So hospitals and physician groups, labs, we now have a kind of a statewide health information exchange where we can actually see information that's occurring if one of our patients gets admitted to an emergency department. And so there's been a lot of investment made in the infrastructure of healthcare through the Affordable Care Act that you might not see on the surface. But long term, these are the types of efforts that will allow for us to continue providing services to a growing population and hopefully do it in a way that's as cost effective as possible.
Great.
And by the way, Medicaid is much more cheap than private insurance. So its growth rate is about half of what private insurance is. So a lot of folks don't realize that. They think it's an old, bloated government system, but it's not. It's actually quite lean, especially in states like ours.
Well, we got a line forming, so that's great. Let's get to our
Just
first.
say something quick about the Medicaid program. There's almost 2 million people on the Access program right now, and people have a distorted idea of who it is. Although 75% of the population are women and children, that's 75% of the money nationally in Medicaid goes to the elderly and disabled. Because when you get sick, elderly, and you end up in a nursing home, which is expensive, many people spend down. So many of these individuals are former middle-class individuals who have spent down, and now Medicaid access is the only safety net you have. It is so critical, and most people don't understand that.
Why don't you go ahead and give us a start? If you want to tell us your name, you can. We're having a discussion and feel safe.
Okay.
Otherwise, you don't have to.
All right. Everybody hear me okay? All right. My name is Dr. Chris Mcbride. I'm actually a psychologist. I live locally. I have to work downtown because I can't find some good office space around here. I'm sure somebody can tell me about that at some point in time. But I have a kind of a longish history between mental health and behavioral health and medical health, because I started off as an EMT, and then I went on to be a crisis responder, and then I got trained up in psychological testing, and so on and so on. I'm really worried about the collapse of our behavioral health system, mostly because, realistically, it has a really strong effect on all of our medical systems as well, because anytime people can't get the appropriate behavioral health, they end up in our hospitals, and then our hospitals get backed up. We've got medics, EMTs, firefighters that are just waiting to drop off. Then they can't attend to people they have to. We have to factor the cost of them being on the streets more because there's not enough available, because we don't do enough preemptive care, that sort of thing. So all this meandering is getting to my point of I'm really concerned about what our current laws are going to be doing to our behavioral health system and make sure that we can not only maintain those who are on it, but also help start doing some of the establishing of the Medicaid care of making sure people don't run into problems where they're feeling suicidal at night or wanting to hurt themselves or somebody else.
Someone want to address, Michael?
Well, the great question. This is kind of right in my area of expertise. I used to work directly in the emergency departments myself and experienced back in 2011 when there was the Medicaid cut and that we had to basically, people were kicked off the Medicaid system. It created a serious problem for hospitals in particular, EMS as well, where individuals would literally be languishing in emergency departments because of a couple of factors. There weren't there wasn't a system in place really to transfer care to. And a lot of those individuals were without insurance. And a number of facilities, even though they're not expected or are supposed to do these things, they do refuse transfers because people are without insurance. And more importantly, there's no safe, efficient outpatient delivery service for them. So even if they get admitted to a hospital for psychiatric reasons, there's not a system that can receive them after their discharge. And so one of the big concerns that we experienced as a crisis mental health provider prior to the Affordable Care Act and during the freeze was we would have people that were in very dangerous situations. They were a danger to themselves or a danger to others. And we could get them into the county hospital, but unfortunately they didn't have any benefits when they left. And so we had people that were essentially on court-ordered treatment with no outpatient treatment to speak of. And these are individuals that need help. We want them to get help. Treatment can be so much less expensive and beneficial to them when they're in the community and they're safely being case managed and provided services and people following up with them. So this is an area of tremendous concern and kind of a reason and kind of a motivating reason for me personally to really speak up, advocate for what we experienced in the past would actually even be a much worse problem going forward if this Senate or House bill goes through.
Okay. So you feel that we'd see kind of a collapse of the current imperfect system as it is?
Correct. It would have a serious impact in the behavioral health system if we implemented the Senate bill. Over time, it would cause some serious problems for the mental health community.
Dr. Kirchner, yes.
I call it the U.S. sick care non-system, and we've separated the mind from the body, and we need to really understand the connections there. But the lawsuit that I reference is Arnold versus Sarn. You may be aware of that. Chick Arnold was an attorney representing people with serious and persistent chronically mental illness. In 1981, he sued the director of the Department of Health Services, Dr. Sarn. That lawsuit went on, and although it's been theoretically settled in the last couple of years, it's still there, basically saying we don't provide the services needed in the community, and that lawsuit started in 1981, so it's not as though it's a new problem. I do think that the Access program is working by putting behavioral health in with the physical health system, and I met with Tom Betlock and the others at Access, really concerned about that. That's one of their major impetuses in moving the system forward.
And I think that's an important point, the co-location, and that's a bill we passed in the legislature very recently, the co-location of mental health, behavioral health with your physical health providers. And that just makes things more smoothly transition. They can talk to each other. My question to you, would some innovative idea like that happen in the absence of this expanded insurance environment of affordable care?
No, you needed the financing to do that. And clearly, what we've done in the healthcare system, we've separated the teeth from the body. Go to the dentist. You know, if you have an abscess inside, it's dental, your insurance doesn't pay. If it's outside, it's medical, your insurance does. Same thing with behavioral health. We have a system that I call chaotic, costly, confusing, inefficient, inequitable, and occasionally superb, which is a paradox. So, how many of us here are cancer survivors? You know, if the system didn't work, a lot of us would not be sitting here right now. So there are times when it works, but it clearly needs a lot of effort.
My concern is that the brain is part of the body, and some people like using it on occasion. And so if we don't take care of it, if we don't prevent things from happening, we're going to have all kinds of problems. I mean, within 3 miles of here, we have Independence High School, who about, a year and a half ago, we had a murder-suicide here. So we got to get on this before it's a problem. But thank you for your time.
Thank you for your question. Thank you. Next.
Hi, my name's Eileen Fine, and I live in Goodyear. I'm a retired attorney. I don't like it. I do understand the desire of Republicans to rob the poor to give to the rich and pass this tax bill. What I don't understand with it is why it is they're willing to cut 1 million jobs out of the economy. This is the healthcare system is one that is the fastest growing area of the market. And almost 1 million people will lose their jobs if this bill goes into effect. And nobody seems to be talking about that in nursing homes. And then the other question that I'd like you to address, if you would, is does this bill as proposed do anything about people who are currently on Medicare? And if not, is it your understanding that in the future that's also what they want to do? Thank
Sam?
you.
So I'll address the first part, and then I'll let other folks address the second part. And I think that we're not talking about it enough, but there are individuals talking about the fact that this would be a huge hit to the economy and a huge hit to jobs. In fact, the State Chamber of Commerce, which is not a source that I go to a lot for political direction, but they came out against the BRCA in large part because of what it would do to Arizona's economy. So to the extent that there is a message that is getting through to some of the members of the Senate majority in the Senate, that is the message that's getting through. But I think that you're kind of hitting on something that is important to talk about here, that this will definitely affect health care, but this was much more of a tax cut bill than a health care bill when the 13 white men locked themselves in a room to dream this up, right? Not a single woman, not a single person of color wrote that bill in any way. So I think that's the first part, though. That I think that is something that when you're calling Senators Flake and McCain, mention, in addition to some of the other things that you're talking about, be sure to mention that this would be a huge hit to the economy. And in fact, the new jobs report nationally that came out today highlighted the fact that, you know, a fifth of our economy growth is in healthcare. So this would totally stunt that growth and reverse the trends that we're seeing. So, yeah.
Yeah. You also mentioned in your second part Medicare. Now, Medicare and Medicaid are twins. They were signed into law on July 30, 1965 by Lyndon Johnson in Independence, Missouri. And Harry Truman got Medicare Card 1, and his premium was $6 a month for Part B. That's the story. Medicaid was an afterthought. But what's happened is Medicaid has picked up the pieces that Medicare doesn't cover, particularly long-term support and services. Of the 50 million people on Medicare, 11 million are dual eligibles. They're on Medicaid. And they get the services that Medicare doesn't provide: assisted living, home and community-based services, long-term care services, Meals on Wheels, a whole variety of care that seniors, like many of us in this room, need now or will need. And the impact on the budgets is going to impact that population, the dual eligibles. It is a major hit to Medicare. In addition, in the bill, there are other things that handle on the Medicare side. The donut hole and your prescription drug program, that's supposed to be phased out over the next 3 years. That will probably not happen under this bill. And one of my other hats, I'm past president of AARP Arizona. So I've been mucking around with them also for a long time. And we did a survey last month of people over 50. Now, there are very few of you in this room over 50, right? Occasional one. Anyway, so we did a survey and we asked the questions. What was fascinating about the results are that these are parts of the Affordable Care Act that are going away. And so we said, should we charge 50-plus older adults more than younger people? And the answer was 90% said no, and that includes the Republicans. Okay, should we cut funding from Medicaid that helps the seniors live independently? Almost 90% said no, that includes the Republicans. Cutting funding for Medicare and increasing premiums, 90% again said no. Charging people with pre-existing conditions more, no. Even the Republicans, 71% of the Republicans in this poll said no. And the last one was providing tax breaks for insurance companies and giving them big bonuses. And that was close to 100% said, hell no, no.
If you remember what was said when Obamacare was being considered initially was, don't touch my Medicare. Do you remember that?
Mm-hmm.
So
But this
I
bill
think that
does that.
Yeah.
This bill touches Medicare. And to be frank, Paul Ryan wrote a piece called A Better Way last year, 12 months ago, when he thought Hillary Clinton was going to be the president. And in it, he lays out what he wants to do. And his issues are the federal budget and the deficit. And I agree that's a problem. But clearly, the two areas that he has in his focus that he's been afraid to really address in this bill are Medicare and Social Security. Medicaid's first because poor people don't vote. But he's afraid to go after Medicare and Social Security because we do vote.
Yes.
And so
And thank you
there's
for
a lot
that.
of cowardly.
Next question. Let's
Hi.
try to get more people in. The line's getting longer.
Mine's an easy one. So my name is Tanya, and you mentioned two phrases that I have no idea what those mean. So the first one was prescription drug rebate. Who's rebating who?
It comes from the, I think the manufacturers are giving Medicaid, government purchases a rebate, but the Medicare purchasers don't get a rebate.
Oh.
And we want to, why is that? Why is that not the same? And
Right. And what's a donut hole in prescription coverage?
Okay, when the prescription drug bill was signed into law,
You'll find
how
out.
many of you have been in the donut hole with your prescription drug? Hey, you go ahead, go over there and talk to that gentleman. He'll explain it to you.
It's fine. I can ask someone later. I know this woman in pink very well.
Okay, go
Good,
ahead.
because we have a big line. Let's go with the next question. Thank you. Thank you so much.
Okay, I have several questions, but I'll keep them to one. So I read the CBO score, which I have here. I also read the BRCA analysis that Access did, also on its news page, as well as some other articles.
Thank you for being informed.
Yeah, bless you.
Right. And I have to say I was a lot more scared after I read all this than before. So that's awesome. But my question has to do with the waivers. So it says states can apply, but it doesn't specify who. Is it the legislator or the governor? And it says that it can't do federal things that the federal essential health benefits cover, but it can do the state's minimums. And then my second question is, you also don't have to use the funds that you get from the waivers to pay for the Medicaid programs. So where would that go?
So it sounds like a block grant. Is that right, Sam or Michael?
I'm not sure exactly if I understand your question.
I think you're talking about the 1332 waivers, which is essentially when we say that this bill doesn't protect people with pre-existing conditions, the mechanism by which it unravels those protections is states can apply for 1332 waivers, in which they can say health plans no longer have to offer essential health benefits. And what's scary about the waivers is it's literally just the governor submits it to the director of CMS and it gets approved. It's two people. They no longer have to go through the legislature, and there's not as long a process to get it approved. So it's pretty, yeah, I mean, we need to watch those if this passes.
And then what's
Wait,
pass-through
just hang on.
funding? Oh.
Waivers are the way states manage their programs. Arizona's program has been what's called a Section 11 in the Social Security Act waiver since 1982. It's still a waiver system. We waive the federal law. And the federal law is mired in the 1965 law Lyndon Johnson signed. Many of the things are still there. There have been changes, many of the basics. So waivers are ways states manage. Some work well, like I think Arizona's does,
Well-
but it's onerous. Others are
Right, but
problematic.
This would make it less stringent to apply for those waivers, so you could get them more easily.
Right.
They're
So-
different waivers, though.
Different
Just,
waivers.
yeah,
Okay,
yeah.
got it.
Some
So it's-
waivers are problematic and others solve problems.
Okay.
We've
Yeah, so
actually
that-
waived a lot of the responsibility to be more progressive and more innovative in the program in years past. That isn't always the case moving, or won't always be the case moving forward, even with the Section 1115 waiver. But what you're talking about there is a different waiver that is definitely a scary piece of the law.
And then what's pass-through funding? Pass-through
Pass-through
funding.
funding.
Pass-through funds.
Well, I mean,
Oh,
some.
Yeah, I didn't know what that term was.
It usually just means that, so they're federal tax dollars that the feds never use. They just give to the states. So it's literally, they're your tax dollars that you pay in federal income tax, but then the federal government never really touches them. They send them directly to the state. So they're just passing through.
Or one agency may handle funds for another without spending them. It just passes through an agency to another.
All right, thank you.
Yes.
Sure. Thank you for your question.
Hi, good evening, everybody. Whoops, excuse me. Well, the psychologist actually kind of asked my question, so I decided to turn mine into a comment and say thank you to all of you for your hard work. And you addressed me directly. I am on both Medicare and I'm on Medicaid, and I'm in the mental health system. And I want everybody to know when you go to vote for anything, remember the people that are on mental health. I would not be alive if it weren't for the mental health system. I suffered a 2-year depression that was catastrophic. It destroyed my life. And if it weren't for Southwest Network, which is one of the mental health agencies, and Southwest Behavioral Health, I would be not standing here today. I would not be standing here today if it weren't for Medicare. I would not be standing here today if it weren't for Medicaid. And I want to say thank you to all the people who pay their taxes and believe that paying taxes makes for a better society and for better government. So thank all of you.
Thank you. We're glad you're here. Thank you. Yes, ma'am.
Yeah, he made a great point that these two programs, Medicaid and Medicare, are linked at the hip. And when you impact one, it impacts the other. Thank you for saying that, because what you said is so true, and it's a major issue that doesn't get a lot of attention because it's really, in some ways, it's wonky and getting down the weeds.
My question has to do with the insurance companies, meaning on the ACA currently we have Ambetter as the only insurance company, and why pressure is not being put on like Aetna, who wants to be, they want to combine with another company to make themselves bigger, and, that kind of thing. Is why aren't we going after the insurance companies?
All right, Michael.
I completely agree with you. I actually have a proposal, and it's actually part of the 1332 waiver, where we could use our current Medicaid system and expand the Medicaid system to incorporate individuals that are covered by the exchanges, the federal health exchanges, or in some states, their own state exchange. So we currently have 1.9 million people that are covered by the Medicaid system in Arizona, and we have about 200,000 individuals that are covered through the exchanges, some of those plans being Ambetter. And if I could just remark just quickly about Ambetter. Ambetter is owned by a company called Centene. And Centene, if you've been kind of reading and watching the news and so forth, everyone is running out of the exchanges. Centene is running into the exchanges and providing care because of other organizations leaving. And so Gary Morris with me here from Crisis Preparation and Recovery, we do our part to kind of recognize those organizations and thank them for kind of stepping in when everyone else is leaving. So one of the proposals we have is that if you're going to do business in the state of Arizona, whether it's in the Medicaid system or provide a Medicare Medicaid plan, that you cannot run from the exchange. You have to participate in the exchange and be part of kind of a graduated Medicaid system, so you could pay into that system and get good care.
Because wouldn't that in itself, with all the different insurance companies, that then creates that market to help drive the premiums down?
Correct.
The
problem with the exchanges that is kind of well documented are that the number of people in the exchanges are relatively small. In our case, it's 200,000 people in the state. It's a relatively small number when you're talking about health policy. So the problem is we have individuals that typically need the care. So you have individuals that maybe have a pre-existing condition, have higher health costs. And so that creates a problem where those plans become much more expensive to run. But if we take 200,000, add them to the 1.9 million,
Right.
That's now a plan that has a little bit more leverage. You have younger kids, you have, and so that's really what I think we continue to push for and advocate for. I'm a big proponent of Medicaid. As Sam mentioned, the Medicaid system will help you when you're born, will help you when you're in a nursing home, will help you if you need medical transportation, will help you with mental health services, long-term care services. We really have a fantastic system that I'm proud to keep pushing and keep supporting. We need to stop the criteria at 133%. We need to take that up to something much higher than that to really help a greater group of people in the state.
And that's my article in the paper 2 days ago.
And I know that we're getting to the next question, but I just wanted to mention two other quick things. I think one of the big things that Mike alluded to is there's just so much uncertainty. So one of the biggest steps to make sure that there are multiple offerers in the marketplaces to make sure that there is certainty and security moving forward. So we need some answers there. But one thing, and it definitely isn't true in Maricopa County, it's not true in Pima County, it's not true in other places, but to a small extent, the idea that there's one provider in a county that's a bad thing isn't always necessarily the case. In a big populated county, that is important. But there are nearly 2,000 counties in America that have a single grocery store, and we're not necessarily talking about that is raising the prices on food necessarily. So I think that county by county analysis sometimes can throw off other more important parts. So I just wanted to highlight that.
But when you have small rural companies and you only have Ambetter and you kind of get to, you've got to drive.
Right. Definitely, yeah.
Yes, ma'am.
Hello, my name is Belinda Dunbar, and my question has to do with pre-existing conditions and the disparity between women's and the men's. For women, we have C-section, hysterectomy, postpartum depression. Pregnancy, they did give that a joint venture. But why wouldn't BPH, low T, erectile dysfunction, why are none of these on this list? Everything is for the woman. I know the 13 men were in the back room, but there's not one condition for just the man himself. So women are going to get screwed. Sorry. That's a joint venture.
You bring up a great point, and I think that one of the reasons why we're not seeing those is because of who developed the plan.
Yeah.
Any other comments from the
Well,
panel?
I was just going to say that's one of the, we've talked about mental health, you're talking about women's health, pharmacy. These are the things that are going to get trimmed from both marketplace plans as well as our Medicaid plan once you start feeling the crunch, in terms of the huge cuts. So when insurance companies can pick once again what they want to offer and what they don't, it's going to be the mental health services, the behavioral health services, and it's going to be a lot of times like maternity care and women's health. That's going to be the first to go. So.
Thank you for your question. We have about 15 minutes left. I'd really like to get to everybody's question. Sir?
Okay. I'm agitated. Obviously, we're all against this bill, okay? This is nothing but cashing people's lives in and giving the money to the rich. That's all it is, okay? But we're in the weeds here, folks. We're in the weeds about how complicated our system is. We all know it's complicated because we live with it. You have any medical expense, you know it's complicated, but it doesn't have to be this complicated. I want to take issue with the idea that Medicaid for all is a better thing than what's really the real issue with Medicare for all. Because if you look at the bill that's in Congress right now, and has over half of all Democratic representatives co-sponsoring it, including Representative Gallego, it's improved and expanded Medicare for all. It's where we take all the money and we put it into one insurance fund. Then it's really insurance. We're all in the same thing. You put everybody in, nobody out, and everybody has a stake in that being quality care. My question to the panel is, why do we have insurance companies? What do they give to health care? And is it not true that 31 cents out of every health care dollar goes for administration, and that we pay more than any country in the world for our care, and we don't cover everybody, and most countries, advanced countries, do? So we've got to start not just saying no. We've got to say yes to what we really need. We need a national health program. We need improved Medicare for all. And if we end up in this discussion of all the little ins and outs, I'm a nurse. I'm a registered nurse. I've worked for over 40 years. I understand that you guys understand all this stuff because you deal with it every day and it's real people in front of you. I have the same experience. And so we have to learn the ins and outs of all this stuff. But we got to take a step back and we got to look at what we really need. We need a national health program that gives us not different insurances for different people and different, pre-existing conditions and blah, blah, blah. These are all things that are designed to extract money from us for our misery.
I think you bring a great attention to a great point, and that point is how did we get here? And it's very complicated, and our system is very complicated. But if you recall, how did we get here? How did health insurance get attached to our jobs? How did we have separate health insurance companies? It all comes to back to offering health insurance as a benefit as attached to employment. The 1942 Stabilization Act. Right? We couldn't raise salaries, so we offered health care to tract employees.
That's only part of the answer. There's another part on how we got here. If you go back into the 30s and look at the original Blue Cross programs, look at their bylaws, that was a community-rated program that was like a single payer for the community. And what happened is the insurance companies said, hey, I got a great idea. I'll go in and we'll pick off the healthiest people out of those programs and we'll give them insurance for less and the rest of them, it'll go up.
Well,
that's where it started.
You're talking about a paradigm shift and we have to get there. We have to get there.
And it has to start with us. We have to shift the paradigm. People have to demand it.
Thank you. All right. Yes, ma'am.
Hi, my name is Brianna, and this is my son, Easton. Easton is a Phoenix Children Foundation representative. So throughout the year, when you see little kids on the registers at Sam's Club, Walmart, recently he was the main kid for all the Walgreens. He has sickle cell. He was born with sickle cell. He has high blood pressure, asthma, severe allergies, and he also has an enlarged spleen. And my daughter, she's asleep right now. She's 2, and she has a condition called dysphagia, where she double swallows and aspirate things. She's feeding tube dependent, and she's special needs. She has asthma as well. Acid reflux, heartburn. Just both my kids have a lot of health issues, as well as I do. My question is, if my kids, we have access, if access gets taken away, where do my kids go? Because if my kids don't have access, they're going to die.
Thank you for bringing that up. I think that's an important point, is that we are talking about people's lives. And that's something that we need to be centered on. And that's something that we need to make sure we tell Senator McCain and Flake. We're talking about people's lives. Thank you for sharing that. And I think the answer is, and I think Congressman Gallego, that care will still be needed. And that care will still be given, but at a different point in the system. And it'll be through the emergency room, and then through an emergency admission, and those things are so much more expensive, and that's what we need to avoid. Michael?
Yeah, there's another issue going on, that the Children's Health Insurance Program, CHIP, funding expires on the 30th of September of this year. That needs to be reauthorized. I'd like to talk about that. So I know we're talking here about other issues, but that's such a critical issue for this country, and the fact that that's being held back. What are you hearing on the CHIP reauthorization?
It's not. Thank you for giving her a hug, and thank you so much, just for reminding us, why we dig into the weeds and we do all this advocacy, because it's people, it's kids. Nothing about this bill solves anyone's health problems or changes how much it costs to deliver health in our country. It solves no problems. All it does is put 2 million Arizonans at risk. And who are we talking about? We're talking about moms. We're talking about kids. We're talking about seniors who are down to their last penny. We're talking about pregnant women. We're talking about disabled. We're talking about schools. This is who we're talking about. This is what this is about. And thank you for reminding us of that.
And thank you for sharing your story.
And also, where I have health issues too. Me and my sister, my mom almost lost me, my sister, within a matter of about 5 weeks apart. My sister got airlifted to Phoenix Children's Hospital. She had a brain aneurysm and went to a stroke. She went into a coma, stopped breathing on her own, and she ended up having 2 brain surgeries. Then about 5 weeks later, I went to the hospital, St. Joseph, for just a chronic migraine. Day 2 of being there, I got a pneumonia vaccine. By the 4th day, I had a temperature of 106.6, and I got rushed to ICU. All my veins collapsed, and I was about to get checked out too. And as a result, now I have fibromyalgia, I have neuropathy, complex regional pain syndrome, I have restless leg syndrome, I have all these health issues. And my sister, she suffered from seizures. They tried last year to take her off of a seizure medicine called Keppra. And as soon as they took her off there, within 24 hours, my sister went to a bad seizure, and they had to airlift her again. They said that that's the worst seizure they ever seen. So where will we go if we lose access?
Well, it's for you and for your family that we're all here fighting to keep your access to health care. That's why we're doing it. Thank you for sharing your story. Thank you very much. Thank you.
Thank you, everybody.
Yes, ma'am.
Hello. Hoi. Okay, I just would like to bring up one thing, and that doesn't come up a whole lot in this debate, but I've read a bit about it. What about the idea of actual price controls on pharmaceuticals or maybe on even procedures? Now, unless in case this sounds like kind of a wacky idea because no one's much mentioned in American healthcare debates, what a lot of people don't know is that Germany has mostly had a system fairly similar to Obamacare since 1883. Yeah, that's right. Except for the Third Reich and the Communist East, Germany's mostly operated on a system that's very similar with universal insurance. It's something similar to our exchanges. It's a bit different. I won't bore you with all the technical details, but one of the things they have, besides the fact that their insurance companies are all truly nonprofit, is they have price controls on it. For example, if you are a German citizen, you go into a hospital, say with a average risk tonsillectomy or uncomplicated childbirth, hernia surgery, whatever, hip replacement or whatever, there is actually a standardized, I can't pronounce the word in German, but there is a standardized kind of system that says exactly what that's going to cost. And not only are those significantly below U.S. averages when, even when you consider national differences and the currencies, but it saves a huge amount of money on administration and doesn't allow a few hospitals to charge dramatically more than the rest and leave patients in the dark. Because most Americans, when they choose, besides whether or not it's in-network, most Americans have no idea what the services are paying for actually cost, and who can blame them? I mean, if you're in the emergency room with a broken leg, it's not exactly the time to go doing price comparisons. If you have to get a tumor removed from breast cancer, you're not going to go shop around at that point.
Can we just address a question? We just have a few minutes left, so I really want to make sure we get your question.
Yes, sir. But I just wanted to know if anything was being said about that or done about that, because it almost never seems to come up.
And I think that's a great point, and what we need to do is expand the discussion. And expanding that discussion, we can do that through our representatives, but also, as someone who does try to write policy, one of the things I do is to say, who's doing this in other states? How are they addressing this problem? And maybe we should send a study committee to Germany or Australia or Canada to say, how are you addressing these problems? So I think that's something that we could do to broaden the discussion. Panel, you have anything to add?
Thank you very much.
For being here. Yeah, I just wanted to comment real quick. I think part of the problem, obviously, we allow kind of our pharmaceutical companies to, not compete with price and exactly. So I think the other big issue about why our costs are higher is the insecurity that so many people don't have insurance, even before the Affordable Care Act. So hospitals and other healthcare providers were providing care with no reimbursement, and so that means everyone else's care would get increased, and it would become a much costlier system. So
that's what we're going back to.
Exactly, that's what we're going back to. Unfortunately, unless we, there are a lot of folks in this room, Brianna, that are standing up and are working hard to try to stop this Senate bill and this House bill, and hopefully we can be effective. Just a quick comment about, I would love Medicare for all with a Medicaid-style benefit, though, because the Medicaid benefit is a richer benefit in many ways than the Medicare system, but a universal system.
Next question.
All right. First
Real quick, we have just a few minutes
The woman
left.
that got up and talked about women's health issues. That's actually kind of where mine comes from. When my wife was pregnant, I was paying for COBRA through a company job I'd had previously, and the company was going away. They were shutting down, and basically they said that since my insurance contract was through the company, the second that the company ceased to exist, so did my insurance. I thought, well, I should get insurance. I've been insured my entire life. I've had double insurance a couple times because to make sure that I didn't have a time when we didn't. So I went out and said, okay, I'll go get insurance. I couldn't get insurance because somebody in the house was pregnant. Wasn't me. I wasn't having a kid, but I could not actually go get insurance. This was before Obamacare, of course. Shortly before that, we could have just waited a little bit longer. We'd been fine. So I found that rather annoying that I couldn't get insurance. Luckily for me, the owner of the company basically kept it running, and 3 days after my son was born, I could go get insurance for two of us, just fine. And 3 days later, the company shut down. My COBRA went away, so I was able to make that work. Now, more recently, I was let go from a company and was looking at COBRA again, and or insurance through my wife's company, which is a school, and of course teachers get treated so well in this country. The family insurance plan for teachers is horrid and expensive. So Obamacare was by far the most economical thing for me to take. Far less expensive than the COBRA, far less expensive than through her insurance company. And I would have loved to stay on a non-employer insurance forever because I don't want to be tied to the employer.
Just need you to get to
get into the question. But I thought those were important. The thing with being able to go to Obamacare, as I was able to go and in a couple hours have insurance and make sure my son and I were covered and know what we were getting, right? Because Obamacare had a floor for what is going to be covered and what's going to be taken care of, right? Through the plans have gone through the Republican plans have gone through the House and gone through the Senate, they're taking away that floor. So we don't know what's covered. Funnily enough, I thought when I lost my job, my primary goal should be go find another job and pay my bills rather than spend days and days reading insurance legalese and contracts that I don't understand to make sure I'm covered. So is there a simple comparison to what we have under Obamacare, what the floor is, versus what are coming out of these plans for what the floor would be? Because I know they were trying to push through a state by state. Oh, maybe pregnancies are covered. Oh, maybe they're not. Or women's care is gone.
So I guess what you're asking, is there a bare minimum coverage with the new?
Is there a comparison so I can see what we have now versus what they're trying to push through?
Sam?
So there are a lot of comparisons, and I guess just the quick answer is that we don't know what the final thing is because Mitch McConnell sent everybody home for the 4th of July holiday, and he's working in the back room. So whatever is going to come out in the week of the 17th or the week of the 24th is going to be dramatically different probably than what we see here. So there really are no comparisons.
I just want to respect everyone's time.
Yeah.
If we could just get to our last two questions very quickly. Yes, sir.
Hi, my name is Mike Johnson. I'm fortunate enough to have insurance through my employer. My union was smart and negotiated that our premiums can only go up so much per year. Why can't the states do that? I know what California has, that they said premiums can only go up 5% a year. Why aren't we able to do that nationwide?
Does our program in Arizona have any limitations on the changes through access, or?
Well, Access is a contract that goes out for RFP, but Department of Insurance has some control over the insurance agency that you would have for employer-based insurance, and their control over their rate increases is very minimal. Some states, Department of Insurance has strong controls, Arizona does not.
So that's one reason why they keep saying that Arizona's failed, because the insurance premiums have gone up so much.
The Department of Insurance does not have a strong hammer to use in controlling premium increases.
Really quickly, just we got to get out of here, so I want to respect everybody's time and everybody's questions. So, what?
Yes, my name's Stephen Miskell, and I'm here to tell everybody we need to make sure that Senator McCain, Senator Flake, do not vote on this awful bill. She works in the field of occupational therapy assistant. So she treats children with physical and cognitive disabilities. She's been doing this kind of work for over 20 years or more. And many of her clients get their services through Medicaid. Otherwise, they wouldn't get any kinds of services. Any one of you here at any time in your life will develop a pre-existing condition, which will, in the past, insurance companies used to just eliminate that as a service. They would eliminate those individuals from receiving any kind of insurance. My wife has a primary immune deficiency disorder. And she was diagnosed with this about a year or two ago, and she receives immunoglobulin injections each month, which basically keep her alive.
I'm glad
it
that's
allows her to
available.
work. And without those, a cold can turn into pneumonia, could turn into any kind of small, simple illness, can turn into something that could kill her. She has asthma, she has diabetes. So, it seems to me that the Republicans are shooting their own foot by keeping people like my wife from working. And that would be the result if they were to eliminate protections for pre-existing conditions.
I'm glad that.
Yeah.
And I'm glad that your wife is getting the care she needs, and that's why we're all here tonight, to continue to have her access to her care. If we can get that one last question in. Thank you, sir. Thank you very much.
I have one fast question, one fast comment. I'll go with the comment first. Those of us who are of a certain age remember how it used to be. And Trump Care is how it used to be. My husband and I fighting to dig up money to pay for the pregnancies. Then we had to pay for our birth control, etc. And when I was 40, I was denied pre-existing condition, eczema on this finger. And I said to my husband, I remember at the time, by the time you're 40, 45, who hasn't had something? So just remember to educate people in your family, people that you know, because everybody has horror stories from the old days.
One more question.
Number two.
Anyone in the room who doesn't have a pre-existing condition, raise your hand. I'd like to meet you. Is there anyone?
Real quick question so we can wrap it up. Everybody's
my
itching
quick
to...
question, maybe Dr. Kirchner could lead me to where I could find this out. I'm interested in what will be the result of Trump Care on our rural areas in Arizona, our clinics, and the number of clinics that we have and the populations that we serve? Where can I find out that information?
Yeah, there are a number of studies that have come out. Clearly, we don't know what the bill is going to be in total, but we do know that the impact on rural healthcare, critical access hospitals, rural clinics around this country are going to be severely impacted. And what we do know as an example is those states that did not expand Medicaid, like Texas and Florida, the rural health systems are collapsing in those states because they didn't do what a very courageous governor, and you may not like my saying that, Jan Brewer, stood up and said, we're going to expand, and she took a lot of heat, and she stuck with it for 6 months. You know, I've known Jan since the 80s. There were lots of times I agree with her and lots of times I didn't. I always get a hug from her. But, man, she was courageous there, and she did the right thing. We got to continue what she's doing.
Thank you very much.
And I want to thank you all for what you do.
Thank you. Closing comments from Wendy.
That's the Russians calling you again. What's going on?
I thought I told them not to call me.
Call you. Well, go ahead and talk back. Yeah, she doesn't know how to turn it off is the problem.
That's actually pretty accurate.
The technology stuff.
So, ladies and gentlemen, what an amazing panel of healthcare experts. We have Sam Richard of Protecting Arizona's Family Coalition. We have Mr. Michael Boylan, and he is from Crisis Prevention and Recovery. We have Simon Kassim, and she's from the Children's Action Alliance. And we have the hometown hero here, Dr. K. That would be Leonard Kirchner. Can I have a nice round of applause for them one more time? Thank you, thank you.
Don't forget Dr. Freeze, too.
I'm getting to Dr. Freeze. I've got something special for Dr. Freeze. Dr. Freeze, I would like to ask you to help me make a call to action. Would you like to do that? So we have some options. We have postcards. Did everybody get a chance to fill out a postcard when they came in? I hope so. We have Save Our Schools petitions available for signatures. We'd like to thank Save Our Schools, and we'd also like to thank AZ Blue 2020 for being here tonight. Sure hope you had a chance to learn what those groups are about. And we'd also like to thank Indivisible of CD5 for their contributions tonight. And AZ Resist, of course. Did I miss anybody? Of course, Indivisible Phoenix, Indivisible PHX, and many, many indivisible groups standing indivisible. Ladies and gentlemen, special thanks for Cluck the Flaky Chicken. So, are you familiar with ResistBot? Mm-hmm. Okay, so who can tell us about ResistBot? Okay, Susan.
ResistBot is, I don't know the actual phone number, but see, they have it by memorized, so maybe I'm not. They have it by memorized, so maybe I'm not the right person. But you can actually go into your smartphone, whatever kind of smartphone you have, and they will send messages, faxes, whatever you want, and resist for you to your congressman or legislator of choice. And I think they're even doing it to, somebody told me to council members, governors, and I mean, they're expanding. So it's really awesome, and it's very easy to use.
What? So do you have your phone on you?
Tell me again, and I'll repeat it. 50?
You're the guinea pig. Okay, so can everybody get their phones?
09.
Can everybody get their devices
We'll get
out
it to you.
so that we can? Here, I've got mine. The Russians again.
Oh, type resist. Nice. Did you guys hear that? She said it comes to you every day and says, what would you like to say today?
Okay, so let's text.
Okay. I had to get some sleep so I can go join Dana in the morning.
Did you get it? 5 calls. There's 5 calls as well. So I would like everybody to engage in a call to action here with the resist bot, the social media device. Text resist at 50409. And I'd just like to remind you that soon there's going to be a vote. Yep, they're going to attempt to vote on the so-called health care bill. And there's no reason to believe that it's going to be substantially different from the versions that we've already seen. Giant tax cuts for the wealthy, tax cuts to be paid for by literally cashing in the lives of thousands of people. So I hope you've all had an opportunity to fill out the postcards and also engage in the call to action through ResistBot. My name is Wendy Garcia. Just want to say thank you on behalf of Indivisible, Surprise, and all my friends. We encourage you to join an Indivisible group near you if you have not already. You can find out more about it at indivisibleguide.com. You'll find that, Tanya, how many Indivisible groups do you think there are in town? Okay, so one near you. So on behalf of our panel, Dr. Leonard Kirchner, Sam Richards of PAFCO, Cinnamon Kassim of the Children's Action Alliance, and Michael Boylan of Crisis Prevention and Recovery in Phoenix, and our fine moderator and now expert resist text botter, Dr. Randall Freese. Thank you. I want to mention that you did a really great job tonight moderating this rowdy bunch. Yes. Why, you ought to run for higher office, sir.